Hello everyone, this is Dr. Shubham, and from today's session I'm going to start with the PSM subject. And PSM, I will try to make it more and more interesting and more valuable, so that whatever time you will be sparing with me in reading the PSM, it would be worthy, I can guarantee you. So what would be my approach to teach you guys the PSM subject? Basically, I will take one topic, right, and then I will try to discuss the concepts, which I will try to make the concepts interesting, and then I will be talking about some of the factual data in the relative topics in the PSM, and then at last we'll try to apply that knowledge which we will learn in the chapters basically, and then we'll try to apply that knowledge later in the MCQs, right? So I will be following this approach, and I hope you will be enjoying these particular sessions. So with that, I'm going to start with the very first chapter of the PSM, and that is the concepts of health and disease, right? So if you talk about the concepts of health and disease, there are two important factors, as you can see, that is health and disease, right? So first of all, if you talk about the health, then according to WHO, right, if you talk about the health, right, according to WHO says that health is a state of physical, your mental and the social well-being, right? Generally we think that what is health, right? They will say that usually if the person is not having the disease, that person will be healthy, right? But the WHO has some modification in this definition. They says that health is a state of physical, mental and the social well-being, but not only the disease, right? So yes, the person is not having the disease, very nice, but along with that, the person should be having the state of physical, mental and the social well-being, right? So what is health, guys? So according to WHO, right, according to WHO, the health is a state of physical, mental and social well-being, right? But not only an absence of disease, right? So along with absence of disease, the person should be in a healthy state, in a sense that physical, mental and social well-being, right? Okay, so this is health according to WHO. Now if you talk about the health, right, how we can achieve that? So particularly the person should be disease free, right? So if you talk about the disease, right, so disease is having three factors, right? How we can tackle this disease basically? So we can tackle this disease like this. For example, I'm just writing the disease in the center, right? And first of all, there should be one factor, right? Usually there is one factor which is causing the disease, right? Now that factor could be any cause, right? So I'm just writing that, for example, the cause of the disease, right? The cause of the disease. Then if we find the cause, okay, and we know that now due to that cause there is a disease, now we will be trying to treat the disease, we'll try to control that disease, right? So we'll be controlling that disease, we'll try to at least control the disease, and once we will be able to control that disease, then we will try to prevent that disease, right? Right? For an example, let's say influenza, right? It is a viral disease. Now influenza might be happening due to so many reasons, right? For example, cold climate, okay, the weather is changing and all of these things. Influenza is a very common viral infection, right? For example, due to that reason, due to any cause, the person is having this disease, right? Person is feeling unhealthy, right? Because he's having a disease due to influenza. We'll try to control that disease, we'll try to treat the disease by the help of some drugs, okay? We'll try to boost the immunity of that person, and once we will once we will control that particular disease, then we'll try to prevent that, okay? For the prophylaxis purpose, we will tell them that take the healthy measures to prevent from that disease. We are having the vaccinations for the prevention of the disease, right? So that is the That is the meaning particularly. So cause, then we'll try to control the disease, and then we'll try to prevent the disease. So prevention. Okay, prevention. Fine. So for any disease, first we'll try to find the cause of the disease. Then we'll try to control the disease, and then at last we'll try to prevent the disease. Okay, that would be the best thing. Now I will talk about these particular three concepts, okay, in detail now, in bit detail. So let's talk about the cause first of all, right? So let's talk about the concept of disease causation, right? In the causes of the disease, what we can talk about. So first one, I'm going to talk about the concepts of disease causation. Concepts of disease causation, right? Okay. So in the concept of disease causation, we are talking about first thing, that is the epidemiological triad, right? That is the epidemiological triad. So for an example, that is the epidemiological triad, right? So what are the things we are reading in the epidemiological triad? It says that it is having three factors. What are these three factors? It is having agent, okay, then host and environment, right? So agent, host and environment. Now look, very simple to understand. If there is some agent, right, there is some microorganism or there is some pathogen, right, it needs some host to survive, right? For example, that virus or that any kind of pathogen will be finding the host, and that host could be the human. So that will come into the human, so it finds the host, right? It found the host. Now after finding the host, it will try to survive over there, right? It will try to multiply in the human body, or it will try to multiply in the host, and like that, right? And it needs the suitable environment also. So agent, host and environment, when these three things meet up, they will be actually making the epidemiological triad, right? Very important for the MCQ also. So agent, host and environment, they are making up this epidemiological triad. Then second concept we read in this, that is they came up with epidemiological triangle now. So once we are clear with the epidemiological triad, then we are talking about epidemiological triangle now. Okay, so what do I mean by that? Same thing, right? Now I told you in the triad, it is just modification of this triad. Epidemiological triangle basically is a modification of the epidemiological triad. Now what do I mean by that? Simple, same thing, right? So here is the agent, okay, here is the host, and here is the environment, right? So there is a host, there is a agent, there is a host, right? And there is a environment. These three things are there. But with that in the center, there is a concept of time, right? So they are including the time. If they will be including the time in this epidemiological triad, then it will make up the epidemiological triangle. So epidemiological triad was agent, host, environment. If you will introduce the time in it, that will make the epidemiological triangle. Next thing which they introduced over here, that is the advanced epidemiological triangle now, right? In some books you might find actually advanced epidemiological triangle, right? So let's talk about that as well. You know, everything is related to each other, guys, right? So in the advanced epidemiological triangle, what happens actually is that in this case we'll replace the factors. For example, there was agent, right? We'll replace the agent with the causative factors, right? There was agent, we'll replace this with the causative factors. I'm just writing over here. So yeah, so agent we are replacing with the causative factors. There was host we are replacing with the population. Okay, and environment with the environmental factors, social factors, socio-economical factors. Okay, so these kind of cultural factors, so these kind of factors we are introducing in place of environment, right? So there could be many factors, right? So let me just slide it down. Yeah, so Here it could be the environmental factors, right? Environmental factors, okay, political factors, nutritional factors, okay, so many factors could be there. Nutritional factors, cultural factors, right? So that is the thing. So very simple. First of all, in the epidemiological triad, we have talked about the agent, host, environment. Then we talked about the epidemiological triangle, agent, host, environment, and in center there was time. Then we talk about the advanced epidemiological triangle, where we talk about that agent will be replaced by the causative factors, host will be replaced by the population, and environment is replacing by the cultural factors, political factors, economical factors, social factors, environmental factors, like these. Okay, so this will make up your advanced epidemiological triangle. This will make up your advanced epidemiological triangle. Very simple. Till now, I hope everything is clear. Okay, sometimes they ask you which of the following is not a factor of epidemiological triangle, which of the following is not a factor of epidemiological triad. These kind of questions might be asked. That's why I have told you this. Okay, next thing in this concept of disease, there is one important point, that is the iceberg phenomena, and questions are asked very frequently from this. What is the iceberg phenomena? In our daily practice, okay, as a doctor, in our daily practice, we are actually dealing with this iceberg phenomena. How we are dealing with the iceberg phenomena? Let's find out. So here we shall talk about the iceberg phenomena. Okay, so let's talk about that iceberg phenomena, right? So in the television and all, or in the movies and all, you might have seen this iceberg, right? How it looks? It looks something like this. Okay, it looks something like this, where you can see the iceberg is there, right? But what we can see from our eyes, we can see from our eyes only what is seen above the sea surface, right? But what we can't see below the surface of the sea, that will be actually submerged under the water. Okay, for example, in this image, what you can see, actually we can see this much part only, which is present above the sea level, right, above the surface of the water. But that much amount which is submerged under the water, we don't know about it, right? We are not aware of this. Okay, and generally we think only this much is the height of this iceberg, only this much is the height of this iceberg, right, generally. But we don't know the depth of it. We don't know the depth of it. We are not aware about this much depth of the iceberg, right? Now let's apply this iceberg phenomena, okay, in this particular subject, right? Now what do they mean by this iceberg phenomena? They say that, right, what do they say? They say that whatever you can see above the level of the water, right, they will be denoting the visible cases, right? So patient came to your clinic, right? You are actually sitting in the hospital, for example, you are doing the OPD, and the patient came to your room, okay, and whatever signs and symptoms the patient is showing you, right? For example, you are actually trying to diagnose the disease in this patient. Patient will tell you the symptoms. You will try to find out the signs in the patient, right? So whatever signs and symptoms you are able to make out, right, that would be showing the iceberg, right? That what we can see actually, this much part. So whatever signs and symptoms you are seeing, it means this much part, right? So with the help of your knowledge, you will be able to actually diagnose the disease, right, clinically, right? You will be having so many differentials in your mind, and you will try to rule out, okay, it could be this, it could be that, it could be that, right, like that. Now then what do you think? You will be trying to take the help of investigations, right? For example, you will be actually ordering the CBC of the patient, LFT, KFT, and other kind of tests, depends on the patient's status, right? So over here, what you are thinking, right? Because you don't know about the disease particularly, you are having so many differentials in your mind, so you want to rule out those kind of differential diagnoses. So to rule out those differential diagnoses, you want to take the help of investigations, right? So that why you are taking the help of investigation? Because you don't know. So that is the submerged portion of the iceberg. So that is the submerged. It means the submerged portion of the iceberg says that the hidden cases, tells you about the hidden cases in which the patient may be asymptomatic, the patient may be pre-symptomatic, the patient may remain undiagnosed, right? The patient may have the latent disease, the patient may be ignored, right? So these kind of things which you can't see from your eyes in your patient, that would be the submerged portion of the iceberg, right? And what you can see from your eyes, that would be the apparent portion of the iceberg. Okay, so here we can talk about the apparent cases, apparent cases, right? And here we can talk about the inapparent cases, right? Inapparent cases. Now almost around 10% of the cases you can diagnose, right, clinically only. But most of the disease, okay, they have this iceberg phenomena, they show this iceberg phenomena, they have the submerged portion, right? It means you can't tell confidently that this patient is not having this patient not having this, because you don't know. The patient is not showing you the signs and symptoms, but that can be hidden inside the body, right? So 90% of the patient, 90% of the diseases shows the submerged portion of the iceberg phenomena, right? They show the iceberg phenomena, right? So what are the disease that shows the iceberg phenomena and what are the disease that do not show the iceberg phenomena? That is very frequently asked in your MCQ. I hope you are clear with this concept, that what is iceberg phenomena and what is what is iceberg phenomena, and what do these above the surface of water, what tells it, and below the surface of water, what tells it, right? And the surface of water, right? If you talk about this surface of water tells you about the demarcation line. Okay, it tells you about the demarcation line. What do I mean by that demarcation line? Demarcation line means, right, it is in between, right? Like you may diagnose it clinically by the help of signs and symptoms of the patient, or you might take the help of investigations also, because some part of it might be hidden as well. Okay, so those will be the that will be denoted by the demarcation line, that will be denoted by the surface of water. Okay, I hope you got it. So in a nutshell, the diseases which are actually not showing the symptoms properly, okay, or which can be hidden in the patient and you are not able to diagnose the disease clinically, that would be, those kind of diseases are showing the iceberg phenomena, right? And those diseases which can be picked up by the clinical diagnosis only, by the clinical skills only, they are not showing the generally iceberg phenomena, right? So now we'll discuss what diseases are showing the iceberg phenomena, what diseases are not showing the iceberg phenomena. Okay, I hope I'm clear with that. So let's talk about this point now. Okay, so the diseases which shows the iceberg phenomena, which shows this iceberg phenomena. Okay, so what kind of diseases are those? So guys, we are having a mnemonic for that, right? So the mnemonic is PM jumped in ditch to have ruby, right? Just for the mnemonic sake. So P for polio over here. Okay, so just writing with this one, P for polio, M for mumps, okay, then J for Japanese encephalitis, Why I'm mentioning all the diseases? Because they ask you which of the following is showing the iceberg phenomena, which of the following disease do not show the iceberg phenomena, like that. So that's why we should know this. So okay, then I for influenza, okay, then D for diphtheria, right, T for typhoid, okay, then H for hepatitis A and B, hepatitis A and B, right, then R for rubella, okay. So these diseases, okay, you can take the help of this mnemonic to remember this. So these diseases are showing the iceberg phenomena. The diseases which are not showing the iceberg phenomena, that we should know as well. So diseases not showing iceberg phenomena, not showing the iceberg phenomena. So that you can also remember by the help of just 3 diseases, guys. That is MTR, right? Measles, tetanus, and rabies. So measles, tetanus, rabies, they do not show the iceberg phenomena. it means you can diagnose them clinically, right? They are showing the apparent cases. Okay, fine. So these kind of diseases will be coming under the category of visible cases. Okay, I hope I am clear with that, right? Now I'm moving next. So we were talking about the disease, right? First of all, in the disease we talk about the causation part, right? What is causing the disease? So we have talked about that. Then I'm coming to the control part. So what is the concept of control of disease? So let's talk about now the concept of control. Okay, so first one we talked about concepts of disease causation. Now we are talking about concepts of disease control. Okay, so second one would be concept of disease control. Okay, concept of disease control. Now in this case what we can talk about, so in the control phase, if you talk about, basically this is the phase in which we are trying to control the disease, right? In which the disease is no more a public health problem, right? So what they say, that if the disease is no more a public health problem, then it is coming under your disease control concept, right? For an example, we generally say, there are programs also. However, in the later classes, I will tell you the different programs from the government schemes, right? What programs we are telling you. There are different programs for the control of the disease, for the elimination of the disease, for the eradication of the disease. Okay, that programs I will talk about them in detail in those sections. But here, for example, I'm just giving you the example. For example, you will study later on the example, like for example, the national vector borne, right? National vector borne disease control program. So NVBDCP, National Vector Borne Disease Control Program. Or you might talk about National Program for Control of Blindness, right? So like that, there are different programs which are actually working in the favor of control of the disease, right? So first of all, we'll find out the what diseases are causing the, what are the causes which are causing the disease. Then we'll talk about the control of the disease, which we are talking about now, right? So first is the control phase, right? Then we talk about the elimination phase. So this is the control phase, guys, right? This is the control phase. Okay, right? So this is the first one. Second one is the, okay, just writing with a different pen. Second one would be the elimination phase. Right? In the elimination phase, we'll try to eliminate the disease. First we'll try to control the disease, then we'll try to eliminate the disease, right? So in this case, we can write that there would be no incidence, okay, or I can write or I shall write no new cases or zero incidence. No new cases or zero incidence. Okay, very commonly they ask you, no incidence or zero incidence cases will be seen in which phase? Control phase, elimination phase, eradication phase, like these. There could be options. So your answer would be the elimination phase. In the elimination phase, there are no new cases. We have eliminated the disease. We have zero incidence of the disease, right? That is coming in the elimination phase. Now, next one is the eradication phase. In the elimination phase, what kind of examples we can talk about, right? So in the elimination phase, we can say that the transmission of the agent, we have broke that chain, right? For example, remember this agent host environment, right? So we have actually broke that chain. Now we are not allowing the agent to come into the host. Actually, if the agent will not be able to come into the host, it will not be able to replicate, it will not be able to grow further, right? So that the disease will be not actually spreading in the community, right? So that is the purpose of elimination of the disease. So you can say we will be actually interrupting the transmission of the disease, right? We will be actually interrupting the transmission of the disease. So you can write interruption of transmission of disease is seen in which phase? of disease control, that is the elimination phase, right? So that has also been asked in the MCQs, right? So what will be the examples if you talk about? What will be the examples if you talk about in this case? For example, National Tuberculosis Elimination Program, NTELP, National Tuberculosis Elimination Program, right? So that can be the example. Now, with that, let's talk about the next one. Okay, let's talk about the next one. That is the control phase we have talked about, elimination phase we have talked about, then we are coming to the eradication phase. So let's talk about the eradication phase, right? Once we have controlled the disease well, then we try to eradicate it. For example, smallpox has been eradicated from India. So eradication phase, right? In the eradication phase, we usually say that the disease, this is a permanent phase, guys, right? The disease is not coming back in the community now, right? So here also there would be no new cases. Here also we are saying that there are no new cases. With that, we can see this is the permanent phase. This is the permanent phase, right? This was the temporary phase. Here, if we will not be able to, if we will not be able to control the disease, then again the disease might come into the community, right? So that's why we should try our best to control the disease. So in the elimination phase, still this is the temporary phase. If you are not able to interrupt the transmission of agent into the host, right, then sometime, somewhere or other, agent might come into the host and that can cause the disease, right? But if you will break this chain, agent host, right, if you will break this chain in such a good manner that agent is not able to come into the host, so at one point of time the agent will not be able to survive without host, right? So this agent will be disappear, right? Agent will not be able to survive. In that case, eradication phase comes, right? So here no new cases, and this is the permanent phase, right? This has also been asked that which of the following is the permanent phase? Elimination phase, eradication phase, control phase. Your answer would be the eradication phase. Okay, right. So once we have talked about this, for example, okay, again let's take the example, as we have talked about example in every case. So here you can take the example of National Leprosy Eradication Phase, right? NLEP, that is the National Leprosy Eradication Phase, National Leprosy Eradication Phase. Okay, now let's talk about another important concept, two concepts, right? And I hope you know this from the COVID era. One is the quarantine and another one is the isolation, right? Very easy. So here also they are asking you the questions from the quarantine and isolation. So what is quarantine? We'll try to compare these two, quarantine and isolation. Quarantine and isolation. Fine. So what is quarantine and what is isolation? Very easy, guys. Okay, you should just know the difference. Usually they're asking you the definition only, right? They will be giving you the 4 options. So what is quarantine? So the quarantine basically we are actually doing for those people who are apparently healthy. For example, what was happening? Some of the traveler, for example, you are studying in some other country, right? Some foreign country, and in the vacation time you came back to your country, yeah, right? Once you came back to your country, okay, for example, if you talk about that COVID era, okay, just 1 or 2 years back, what was happening? If some traveler is coming from another country, there was a mandatory rule that if any kind of traveler is coming into the country, he or she should be actually going for the quarantine period, right? So if any traveler would be coming from any other country to some other country, right, so those countries will be having this rule that they should be going for the quarantine period, right? So it doesn't mean that the person is carrying this infection, but there is possibility that this person might carry the infection, but maybe the person is asymptomatic, the person is not showing the symptom, but the person may carry this virus. So that's why, for the prophylaxis purpose, for the sake of good health of other people, so that if you are actually infected also, you should not transmit this infection to the other people, for that purpose the quarantine period came in, right? So the quarantine we are doing for the healthy individuals, right? So that healthy individual, I mean, this person might carry the infection, this person may not carry the infection as well, but both of these persons should be going for the quarantine period, right, for the prophylaxis purpose of the community, right? So quarantine is done for the healthy people. Always remember, it is done for apparently healthy people. Apparently healthy period, right? If you talk about the isolation, on the other hand, isolation, if you talk about, it is done for the diseased people, right? Diseased people. For example, this person is having this particular virus, okay, showing the signs and symptoms, right? Now this person will send this person for the isolation. So isolation is done for the diseased person. Quarantine, on the other hand, is done for the healthy, apparently healthy person, right? Okay, so it is done for the diseased person, done for the diseased person, or done for the people who are actually already diagnosed with disease, done for the people with diagnosed disease, right, to prevent the spread of infection, to prevent the spread of infection. Okay, fine, this is the basic concept, right? If you talk about the quarantine, it is done for the maximum incubation period, right? It is done for maximum incubation period, right? Incubation period. While if you talk about the isolation, it is done for the period of communicability, done for the period of communicability, right? I mean, if the person, if that particular disease is having the capability of transmission to the community, right? So for that particular time, we need to isolate that person. Okay, fine. Now we are coming, I hope you are clear with the difference between the quarantine and the isolation, right? Now we are coming to a very important part, that is the concept of prevention. So we have talked about the concept of disease causation, we have talked about the concept of control, and now we are going to talk about the concept of prevention. Okay, so third one we are going to talk about, that is the concept of prevention. In the concept of prevention, okay, in the concept of prevention, we are talking about the four things, right? Four level of preventions we are having actually. So what are these four level of prevention? First one is the primordial prevention, second one is your primary prevention, third one would be your secondary prevention, and the fourth one at last will be the tertiary level of prevention. Okay, so lot of questions are coming from the prevention part, right? So the highlight of this particular topic is this, that is the concept of prevention, right? Around 70 to 80% chances are there that if the question will come from this chapter, right, which is most likely, that will come from this particular chapter only. Okay, this particular concept of prevention topic only, right? So in the concept of prevention, we are talking about four level of prevention: primordial, primary, secondary, and the tertiary. So here let's talk about that. So we shall talk about the primordial prevention, primordial level of prevention, then primary level of prevention, then secondary level of prevention, right, and then tertiary level of prevention. Okay, so in this case, right, if you talk about the disease, first of all, right, if you talk about the disease, then before the disease I told you some factor is there which is causing the disease, right? So there could be some factors which are causing the disease. What are those factors I'm talking about? These are the risk factors. So what are the risk factors which can cause the disease? So the risk factors I can write over here, that there could be risk factors which can cause the disease. Once the risk factors are present, right, once the risk factor is present, then we shall talk about the disease as such. So there could be the disease, then that risk factor, for example, there was some risk factor and then it caused the disease, right? After the disease, that disease might have some complication, right? The disease might have some complication, right? So the disease might have some complication, and due to that complication, sometimes it can cause the disability in the person as well, right? So it can cause the disability in the person, right? Or sometimes it can cause a death as well, right? So that is the thing. Now, for example, let me take the example also so that it will become very, very clear. For example, let's take a disease that is diabetes, right? Very, very common. So there are n number of risk factors for the diabetes. For example, the person was having hypertension, right? And let's say this is the risk factor. Now hypertension was there. Due to hypertension, the person also became diabetic. The person also became diabetic, and he was having risk factor for the family history also. He was having the family history of diabetes. Okay, so the diabetes is running in the family history. Most probably this person also might have the diabetes now, right? Let's say his father or mother was having diabetes. Now, having the risk factor that there is a family history, the person is having hypertension. Due to this risk factor, let's say this person became diseased now. Now, if the person is having this disease, that is the diabetes, right? Diabetes having complications. For example, the diabetic neuropathy can be there. The diabetic retinopathy might happen. Diabetic nephropathy might happen, right? Diabetic foot might happen, right? So due to that, gangrene might happen. So a lot of complications might be there. And due to that, let's say that person is having the diabetic foot. The person might be having, due to that, the gangrene. So due to that gangrene, we might actually amputate the particular part of the body, right? Particular part of the body might also happen. So that will cause a disability in that person, right? So this is the classical example of how we can actually take this level of prevention, right? So usually on a daily basis, we are actually using this phenomena. How we are using this phenomena? Very interesting. For example, you, right, who are watching me right now, you are actually, generally, most of you are doing the primordial level of prevention. How? Usually when you wake up, right, you are doing some warm up, right? Some of you are going to the gym, right? What you are doing basically, you are actually using this phenomena, primordial level of prevention. Now, if I will ask you, why are you going to the gym, right? You will be answering me because we want to remain fit, right? So this is the case. So here, this is actually health promotion. You are promoting your health, right? That is the primordial level of prevention. Primordial level of prevention says we are preventing even the risk factor, right? There is no risk factor. There is, in the primordial level of prevention, we are saying there is no risk factor, right? We are doing the health promotion. For example, some of you are waking up and doing the yoga, okay, or doing some warm-up exercises. Okay, some of you are playing some badminton, some of you are going for the jogging, some of you are going for the running, some of you are going to the gym. What you are doing basically, using this primordial level of prevention, right? So try to correlate this thing with your daily life routine. Okay, fine. So if the risk factor is not present, obviously the disease will not present. If the disease is not present, obviously complication will not be present. If the complication is not present, obviously the disability or death will not be present, right? I hope you got the primordial level of prevention. In your daily life routine, you are actually using this primordial level of prevention, right? Okay, moving to the next one, how you can actually talk about the primary level of prevention. Then primary level of prevention, in this case, risk factor is present. Risk factor is present in this case. Risk factor is present. But now, if you are actually doing some measure, if you are taking some measure to prevent this risk factor, okay, to prevent this risk factor to cause the disease, right? For example, we are living in this world and we are actually surrounded by so many of risk factors, right? For example, if the climate is changing, we are susceptible for getting some cold, we are susceptible for getting some viral infection, right? For example, there are so many diseases, right? So in the childhood period, we have took some vaccines, right? The immunization programs we are having from the government side for what? For the protection of this risk factor, because they want to stop this conversion of risk factor into the disease, right? So that is the primary level of prevention. So in the primary level of prevention, we are having the risk factor, right? But somehow, if we will be stopping this, if we will stop over here, right, we are not allowing the risk factor to cause the disease. This is primary level of prevention. So in this case, we have stopped the conversion of risk factor to cause the disease. So that is the primary level of prevention. So in this case, risk factor will be present, but there is no disease, there is obviously, if there is no disease, no complication, no disability or death, right? Next level of prevention is the secondary level of prevention. Here the risk factor is present. The risk factor is present. Somehow we were not able to stop this conversion of risk factor to disease. Now the patient is diabetic, right? For example, now the patient is having disease, and let's say, same example, the patient is having diabetes. But now it depends how the patient is actually taking the measures to, how he is taking the measures to protect himself or herself by stopping this disease into complication, right? For example, the person might be diabetic. Yes, he will go to the doctor. Yes, and as a doctor, what we will tell, okay, please take care of your health status, please take care of your sugar, do the yoga, do the regular exercises, right? And all of these things. But how many people are actually following that, right? How many people are actually staying away from the sugar substances or some delicious kind of sweets, right? So there are not many people. So that's why if they are not taking care of their health, that particular disease that might show the complication. For example, there might be cataract, there might be diabetic neuropathy, nephropathy, okay, there might be the diabetic ulcers, right? Diabetic foot. So these complications might develop. So if you were able to stop the conversion of this disease into the complication. There was disease, but the person is actually taking every proper measure to prevent this disease to convert into the complication. Then this is what level of prevention? Secondary level of prevention. Here the disease is there, but there is no complication, right? There is no complication, and obviously there is no disease as well if there is no complication, right? Now tertiary level of prevention, here we are having the, right, here the person is having a risk factor. Now the person became diseased also, the person is having diabetes. Now this same person diabetes, now he developed the complication, he is having cataract now, he is having diabetic foot now, right? He is having the complication, but somehow now he is taking the good measures, okay, and now with the help of a doctor we are actually preventing this, now we are actually able to prevent this conversion, right? That is the tertiary level of prevention. That's the tertiary level of prevention, right? I hope now you're having a good picture in your mind that what is the primary level of prevention, primordial level of prevention, secondary level of prevention, and the tertiary level of prevention, right? Now we'll try to actually discuss each one of these in a bit detail, and we'll try to get to know some examples as well, right, in each level of prevention. Very, very important topic. That's why I took some time to make you understand this. Now the first level of prevention is we have talked about, that is the primordial level of prevention. Primordial level of prevention, right? I hope you're enjoying, guys. So primordial level of prevention, here I told you that we are actually preventing even the risk factor, right? In our daily routine we are actually trying to do so, right? So that is the primordial level of prevention. Here we are preventing the risk factor. So a very important point over here, that is the prevention of risk factor. So prevention of risk factor, right? Prevention of risk factor. Second point over here, that is very important, that usually we are trying to do it, the early you will do it, the better will be for your body. So mainly in the childhood. So examples, right? For example, you are doing your lifestyle modification, right, on a daily basis. Lifestyle modification, going to the gym, doing the yoga and all of these things, eating healthy stuffs, right, not eating the junk food and all of these things. You are doing the lifestyle modification. You are promoting your health. In a sense, you are promoting your health. So health promotion, right? Okay, trying to boost your immunity by so many other ways. So that is basically the health promotion. You are doing the primordial level of prevention. Very easy. Now next one will be the secondary level of prevention, primary level of prevention. Primordial is done, next one will be the primary level of prevention. Primordial is done, next is the primary. So primary prevention. Now listen very carefully. Primary prevention, what we can talk about in this range. In the primordial level of prevention, we shall talk about that we know that risk factor is present. First of all, risk factor is present. First question is done, right? Risk factor is present. Very important. They ask you this thing, that risk factor is present but disease is not present. What level of prevention? Primary level of prevention, right? Then Here also you might do, some lifestyle modification to protect this risk factor to convert into the disease, right? You can do that. So here also we are talking about the specific protection. Here we are talking about specific protection, right? Specific protection and health promotion, right? Health promotion in a sense that the person is taking measures now. Now the person is doing the yoga, or now the person is doing the exercise to prevent this risk factor to convert into the disease. Okay, so that is the thing. Okay, here what examples we shall talk about. What examples we shall talk about in this case? So examples are very easy. For example, just think where the risk factor is present. For example, immunization. There are several immunization programs from the government of India, right, to provide the vaccination, right? Why we are providing the vaccination? Because risk factor is present. Why we took the shots of your Covaxin or Covishield? Why you took that? Because there was a risk factor of presence of COVID-19 virus, right? So to prevent that risk factor, you took the vaccine. You took the first one, you took the second one, some person took the booster dose as well, right? So why is it so? Because there was a risk factor present in the community, that was the COVID-19 virus, and to prevent that particular risk factor, there was a program of actually giving the vaccination to the persons, right, from the government of India. Okay, fine. So immunization, we are clear that this is a primary level of prevention. Okay, and this comes under the example of specific protection. We are actually protecting the community. So specific, this is the specific protection. So specific protection is a type of example of primary level of prevention. Okay, so immunization is done. Then from the government of India side, family planning methods. Okay, family planning methods are there. Okay, family planning methods. For example, use of contraceptives, right? Use of contraceptives. Why this is coming in this example? Use of contraceptives, because there is a risk factor present. What is the risk factor over here? Pregnancy. They want to avoid the pregnancy, so that's why use of contraceptives, right? Use of family planning methods, right? So that is the thing. Now, in the immunization, we are talking about the vaccinations, right? Several types of vaccinations are present so that we can stay protected from any kind of disease, right? But if they talk about, very tricky question over here, if they talk about vaccine, usually the vaccine, if it is coming in the question, primary level of prevention, right? But if they talk about a special kind of vaccine, that is a BCG vaccine, okay, I'm just writing over here. If they talk about, the question comes, BCG vaccine, which level of prevention, guys? BCG vaccine is used for treatment of bladder carcinoma. Used for treatment of bladder carcinoma, guys. Bladder carcinoma, right? So here already the disease is present. This is which level of prevention? Secondary level of prevention. So that's why this became the tricky question. This is the secondary level of prevention. Secondary level of prevention. So this is not the primary. So that's why if the BCG vaccine, if they are asking you in the question, the answer changes in this case. That is the secondary prevention, not the primary one in this case, right? So I just highlighted this so that, right, you are not falling in this trap. Okay, fine, done. Now coming back to our examples of the primary prevention, then you are taking the food safety measures. Sometimes you are going outside, okay, you are seeing that there are 4 or 5 vendors, right? Now sometimes you are comparing that, okay, this person is taking the proper measures, this person is making the food with so much of hygiene and all, so you will prefer that you will be actually trying to take the food from that particular vendor, right? Why is it so? Food safety purpose, right? So risk factor is present. Food contamination is the risk factor over here. So to prevent that factor, we are actually choosing the, okay, which vendor will be actually going to have our food. So that is what risk factor is present over here, right? So in this case, which level of prevention again? Primary prevention. So food safety is also the level of, which level of prevention? Primary level of prevention. Use of helmets. You are actually driving the vehicle and you are using the helmets. Okay, risk factor is present. What is the risk factor? There could be injury, there could be trauma, there could be accident. That is the risk factor present over here. Use of helmet is which level of prevention? Primary level of prevention. use of mosquito nets. Use of mosquito nets in the house. In your homes, you're using the mosquito nets very frequently. Why you're using that? What is the risk factor present over here? The mosquito might bite you, right? What will happen if the mosquito will bite you? Risk factor, again, it could be malaria, it could be dengue fever, right? So to prevent that risk factor, we are using this mosquito net. Again, which level of prevention? Primary level of prevention. I hope you are with me, guys, right? Okay, fine. Now coming to the next one, we have talked about the primordial level of prevention. We have talked about the primary level of prevention. Now I'm coming to the third one, that is the secondary level of prevention. One example I already gave you, that is BCG vaccine. Okay, good. So here we are actually talking about the secondary level of prevention. Secondary level of prevention. Okay, so very interesting, guys. Secondary level of prevention. So here what we are doing, we know risk factor is already present, disease is already present, right? So here first point, here the disease is present, here the disease, we know that disease is present, but we want to stop over here. We don't want to allow the disease to convert into to show the complications, right? So this is the second level of prevention. Disease is present, but we are actually preventing the complication over here. So prevention of complication of disease. Prevention of complication of disease. Complication of disease, right? Right. Okay, got it. Now next one is, in this case only, we are actually generally talking about, it includes early diagnosis and treatment. If you are treating the disease, we are doing the secondary level of prevention. Why we are treating the disease? Because already we have diagnosed the disease, right? If you are using several kind of screening test, includes screening, diagnosis and treatment. All of these things are coming under which level of prevention? Secondary level of prevention, right? You are taking the help of some screening test. For example, your pap smear for the diagnosis of cervical cancer, right? So you are taking the help of screening test. Which level of prevention? Already there might be cervical cancer, there might be the disease, right? We are actually trying to diagnose it early so that we can prevent the complications, right? Which level of prevention? Secondary level of prevention. So screening, diagnostic test, and the treatment modality, these three things are coming in the secondary level of prevention, guys, right? Okay, so very quickly let's just brush on to the examples. So examples would be like, you are treating the disease, for example, dots. For what you are giving the dots? For tuberculosis, right? For example, pap smear, the routine pap smear for diagnosis of, for making the diagnosis of, for cervical cancer, for cervical cancer, right? So any disease you are treating, which level of prevention? Secondary level of prevention, right? Okay, multi-drug therapy for leprosy patients, which level of prevention? Secondary level of prevention. So now the next point over here is the tertiary level of prevention. Now here it became very easy till now, guys. For example, now you know that here again risk factor will be present. You should be actually speaking with me. Risk factor will be present, then yes, disease is present, then the complication is present. Now you want to prevent the disability in this person, right? So this is the tertiary level of prevention. So here the complication is present, right? Here the complication is present. Complication is also present over here, right? Risk factor is present, disease is present, complication is also present. Now you want to prevent the disability. So what you are doing? Prevention of disability or death. Prevention of disability or death. Understood? Okay, yeah, clear. Now tell me some example. I know you are asking the example. Now this is, for example, there was a patient came to you with a fractured limb, right? So in this case you will be applying a cast, right? So applying a cast, it means you want to prevent the disability of this particular limb. So to prevent the disability, you will be applying the cast, or in case the surgery might be needed for the same case. So this is for the prevention purpose. So what you are preventing? You are preventing the disability of this limb, right? So that's why. So putting a cast, so cast application cast application over fractured limb. Okay, this is one example. Second one, you are prescribing spectacles to someone, right? For example, you are an ophthalmologist and the patient comes to your clinic with for the visual acuity test, and you came to know this person is having the vision problem, and you prescribe the number for this particular patient. Okay, you are prescribing the spectacle for this patient for what? For preventing the disability. Okay, later on the number might be increasing and the person might be going towards the blindness, right? So you are actually thinking to prevent the disability in this patient. So that is the tertiary level of prevention, right? I'm just giving you the examples, right? For example, various kind of reconstructive surgeries, right? Prosthetics, if you are applying to for the patients, right? So these are all coming in the tertiary level of prevention, right? So that is about the tertiary level of prevention, right? Now, whatever knowledge we have gathered till now, let's try to apply it in the main thing, that is the MCQs, right? So let's try to go into the MCQs and let's try to apply some knowledge over there as well. So here are some questions, previously asked questions in the FMGs and other exams. So here let's talk about them, right? So first question is, all of the following are true, right? You should be actually telling in the answers in these cases. So guys, first question over here is that all of the following are true regarding the primary prevention, except. So in the primary prevention we saw that immunization was present, right? And early diagnosis and treatment. Okay, coming to the B option, that is the specific protection. Yes, primary prevention talks about that. Early diagnosis and treatment was coming in the category of secondary prevention, not the primary one. And contraceptives, yes, it was coming in the primary one only. So the correct answer would become the C option over here. Correct answer became the C option, isn't it? Moving to the next one, guys. Screening for cervical cancer. I told you, directly question. Screening of cervical cancer coming into, yes, that is the secondary level of prevention. Screening, diagnosis and the treatment, right? Coming in the secondary level of prevention. Here the answer became the secondary level of prevention. Good. Vaccine is what level of prevention? I told you, immunization programs are primary level of prevention. So it became the primary level of prevention. But BCG vaccine, secondary level of prevention, because it is used for the treatment of bladder cancer. Okay, nice. Tracking of blood pressure is which level of prevention? So tracking of BP is actually secondary level of prevention, because usually hypertensive patient, already the disease is present, hypertensive patient is actually taking this beautiful measure to keeping a record of the BP. They are doing the BP charting, right? So this is the secondary level of prevention. Very important question. Tracking of BP is the secondary level of prevention. Usually hypertensive patients are taking these measures. They are doing the BP charting. So this is which level of prevention? This is the secondary level of prevention, guys. Fine. Okay, now let's move on to the next question, guys. Question number 5. All of the following comes under the primary prevention. All of the following comes in the primary prevention, except. So primary prevention, helmets, primary prevention, yes. Vaccines, primary prevention, yes. Contraception, primary prevention, yes. Pap smear, secondary prevention, right? So answer became A. They asked you except. Okay, nice. Moving on to the next question. Pap smear, same question, repeat question, is an example of. So guys, pap smear is an example of secondary level of prevention. So is an example of early diagnosis and treatment. So this is the secondary level of prevention. So answer became this. Health promotion, specific protection, disability limitation, no. Okay, 7. Desks provided with tabletop to prevent neck problems is an example of what over here? So desk is actually provided. So you are preventing this risk factor. So over here the answer became the primordial level of prevention. So you are preventing the risk factor. You are preventing the risk over here. So it became the primordial level of prevention, right? So this is something new which we have learned over here. Question number 8. Patient is on psychotherapy, right? So patient is taking the treatment, which level of prevention? Secondary level of prevention. So secondary level of prevention. The patient is psychotherapy. Psychotherapy is also a treatment modality, right? Done by the psychiatrist. So that is the secondary level of prevention. Iodized salt is given an area endemic to goiter. Yeah. So usually in India also iodized salt is very popular. So most of the salt branded are actually claiming for the iodine in their salts, right? Why is it so? Because risk factor of goiter is present over there. So to prevent this goiter, we are taking the government of India is also, you know, recognizing this, promoting this. So to prevent the goiter, right? Goiter is a risk factor. So risk factor is present. So that is the which level of prevention? Primary level of prevention. Okay. So that became the primary level of prevention. Primary is not given in the option. So answer became specific protection. Specific protection is the primary level of prevention. I told you. Right. Okay. Next question. Iron and folic acid supplementation is an example of. Here the risk is present. What risk is present? Anemia. Right. So here what could happen? What could have been happened? The patient might have the iron deficiency anemia, or the patient might be having the folic acid deficiency anemia. So microcytic anemia, macrocytic anemia, these are the risk factors. Risk factor is present. It means what? Primary level of prevention. So here also answer became the specific protection, right? I hope you guys are actually enjoying the session. So question number 11, guys, tracking of BP implies. So here the tracking of BP implies, actually I told you this one concept over here, that you know, this usually should be done from the childhood side. So basically what I mean by this is somewhat tricky question asked, you know, many years back. So they asked you tracking of BP implies. So actually the BP of hypertensive patient remain hypertensive. Usually if what happens, I will tell you. For example, at the age of 15 years, let's say this person BP was remaining hypertensive only. Okay, nobody cared for actually checking the BP of this patient, right? Now at the age of 30 years, okay, let's say this patient came with the undiagnosed hypertension, right? He was having the headache, he was having the palpitations, right? These kind of symptoms were there, and now you check the BP is coming like 180 by 120. So this patient will be shocked, like how is it possible, right? Because this patient was not checking the BP from the previous side, right? Maybe there is a possibility that patient BP was on the higher side only from the childhood only, right? But nobody was there. The patient was actually not measuring the BP regularly, right? And the first time he checked the BP and it is becoming like this. So most probably if the BP is on the higher side from the childhood side, okay, most probably in the later phases of life also, it will remain hypertensive only. It will remain on the high side only. So that thing they are actually trying to simplify over here. So tracking of BP, okay, it means that BP of hypertension, BP of hypertensive patient will remain hypertensive only, right? So from the childhood only, one should be actually tracking all these parameters. Now, best for the prevention of risk factor. Best for the prevention of risk factor. So preventing the risk factor, very nice thing. You are doing the yoga, you are going to the gym. Primordial level of prevention. Primordial level of prevention. Primordial prevention means you are actually preventing the emergence of risk factor of the disease. So yes, that is the prevention of emergence of risk factor of the disease, right? You can actually pause the videos in between and you can actually guess your answers as well, right? So immunization is which level of prevention? Yes, I'm hearing your answer, guys. Yes, that is primary level of prevention. Primary level of prevention, right? BCG vaccine is the exception. I told you that already. Then polio vaccine is a type of which prevention? Again, guys, simple question. Vaccine immunization program, that is primary level of prevention, guys. So I hope except 2 or 3 questions, it should be very easy for you to answer all of these questions, right? If you have listened to the explanation part very carefully. So I hope, guys, you have enjoyed this session, the first one from the PSM side. Thank you so much for listening this one, and I will see you in the next one. Thank you.